Youn is here with Chris, who actually works in Dr. Youn's office, and she is our patient this morning. So what we're going to do is show you this new technology. It's called Fractora. Before we do that, Chris, how old are you, may I ask?
52.
52, and you look really good. What are you hoping this is going to do?
Thank you. Just to try to tighten up the lower part of my face.
And have you, working for Dr. Youn, I imagine you're tempted to do the whole mommy makeover.
You got it.
Have you had other stuff done?
I've not had any surgery done, but I have done chemical peels and other things to help with texture and tone of my skin.
Yeah, your skin looks good. Okay, Dr. Youn, what do we do?
Let's have you lean back just a little bit. I'm going to apply a little ultrasound gel. So the idea behind the Fractora is it's a radio frequency device. And it's not a laser, meaning we don't have to wear any eye shielding or anything like that. But what it does is it creates some deep heating of the skin. And the idea behind all lasers is that they heat the skin up to try to tighten it. And when the skin gets to a certain temperature, and that temperature is about 42 to 43 degrees Celsius, it causes the skin to tighten up and even to lift a bit. Now you hear that beeping sound. That beeping sound is telling me just how hot her skin is getting. And we're at about 30 degrees right now, so we're not quite there to therapeutic yet.
So what is it about the heat? It just causes activity among the cells to grow new cells or something?
Yeah, when you heat the collagen of the skin up to a certain temperature, that 42, 43 degrees, the collagen actually breaks down.
Okay.
And when the collagen reformulates itself, it reformulates itself into tighter patterns.
Oh.
So the old style lasers, and a lot of people have had those done years ago, they would literally burn all the skin off your face to get it to that temperature.
Oh, okay.
The new treatments like this, we don't burn the skin, but we can still get the temperature to that therapeutic tightening level.
Now, Chris, what do you feel? Anything?
Just warmth.
Just warm, so it doesn't hurt?
No. Very comfortable.
So you would do this how often and how permanent are the results?
So we do this typically as once a week for about 6 to 8 weeks for maximal results. Then after that we get to a maintenance treatment where it's about quarterly. So this isn't something where you do it and 2 years later you're going to still have the result of a treatment 2 years before.
Okay.
But it is a situation where you do it and you can keep those results up with really relatively minimal work. And you don't have to take work off for it.
Now, who does this work on, Dr. Youn, in what areas? Because if you have the tummy, a little loose tummy skin, is it going to help?
You can literally use it for any part of the body. Some people are using it for the arms, the bat wings that we call them.
Like under here.
There you go. Other people are using it for the tummy.
Not mine, but...
But it isn't a surgical type result, though. Okay,
yes.
So it is not a substitute for a tummy tuck or an arm lift, especially people who've lost large amounts of weight and the skin's really hanging.
Yeah, this isn't.
No, it's not a magic wand per se.
You gotta turn that into a scalpel.
Exactly, but it's for those people who say, you know what, I don't want to have surgery. I've got a little bit of looseness either on my face or on my body, my arms, and I want to tighten things up, but I don't want to take time off of work.
All right.
And you can see your face is a little red here. It costs anywhere from $200 to $300 per treatment, and depends on just how many locations we're treating.
All right, and here we see some before and afters. This is from the Fractora website, but I know you are always nice and honest with us, Dr. Youn, about effectiveness, and so you would say that what difference have you seen in your patients?
It's a nice mild tightening, mild lifting effect.
Okay.
So once again, it's not a facelift. If you see a plastic surgeon and say you need a facelift, this is not going to cause you not to need a facelift. But just overall tightens up the skin, rejuvenates it. No downtime, no pain, not a whole lot of money either.
Yeah, that sounds pretty good. All right, Chris, thank you. You're a good sport.
Thank you.
All right, we'll let you two finish what you're doing here.
All right.
Dr. Youn, thank you for coming in.
Thank you, Dina.
It's always fun to have you here. We appreciate it. Beaumont plastic surgeon Dr. Tony Youn. All right, when we come back, Jason, we got a lot more to come.